Welcome to Harper's Bazaar SkinSchool. I'm Anjali Mahto and I'm a consultant dermatologist. Today I'll be talking to you about adult acne, causes and treatments. Acne is just the medical word for spots, and acne can take multiple forms. It can appear as blackheads or whiteheads or small bumps underneath the skin, red bumps, or the deeper ones that don't come to a head, known as nodules or cysts. These are the ones that tend to last for quite a long time, so we're talking weeks rather than a few days, and can be quite painful and tender underneath the skin surface. We're seeing a rise in female adult acne over the past 10 years in our dermatology clinics, and we're not exactly sure of the reasons why this is occurring. About a quarter of women will suffer with female adult acne, and a lot of women will develop acne for the first time after the age of 23 years. So it's no longer thought of as the teenage condition that we once thought. Now, acne itself has got a number of causes, but it ultimately comes down to a sort of complex interaction between hormones and genetics. Hormones known as androgens are male hormones, which even women have. And these hormones act on the oil glands in the skin to make them bigger and plumper. If your oil glands are bigger, you're going to be pumping out more oil onto the skin surface, and your pores are much more likely to get blocked. Once your pores are blocked, then bacteria can act on the skin surface to create those deeper red spots, which can lead to acne itself. Acne can be triggered by very predictable fluctuations during the course of a female's lifetime. So around the time of your period, the first trimester of pregnancy, and also in the run-up to the perimenopausal period, there are very predictable changes and fluctuations that we see in the relative levels of female hormones versus testosterone that trigger acne. I often get asked a lot about diet and acne, in particular dairy. It seems to be that for a small, select minority of individuals, dairy products may have a part to play in acne formation. What's interesting is that the clinical trials show that low-fat dairy seems to be more of an issue than full-fat dairy. For the vast majority of people, cutting out dairy products is unlikely to make a difference, but if you are sensitive, you may be better off opting for the full-fat option. There is emerging evidence that foods high in refined sugars or foods that have a high glycemic index may also trigger acne. This seems to be because eating sugar will cause a spike in your blood glucose levels. That in itself then results in a spike in other hormones such as insulin and insulin-like growth factor 1. These act on the oil gland to make the oil gland bigger and therefore result in excess oil production and acne itself. The solution here isn't to cut sugar out of your diet altogether, but think about how much you're eating and consumption on a daily basis. When it comes to managing acne, there are a certain number of skincare products that I would recommend in clinic. It's really important to find skincare that contains a number of key ingredients. You're looking for products that contain things like salicylic acid, alpha hydroxy acids like glycolic or lactic acid, niacinamide, zinc, benzoyl peroxide, or even tea tree oil. So a good skincare routine would be something like using the La Roche-Posay Effaclar face wash morning and evening. Cleansing morning and evening is really vital to the skin. A product like the Murad AHA BHA exfoliating cleanser can be used maybe once or twice a week. Possibly any more than that might cause irritation. If you're using products that contain AHAs and BHAs in them, those products can make you very sensitive to the sun. So it is important to have a good SPF, ideally one that is a minimum factor 30, possibly a 50, water-based and fairly matte, so it's not going to block your pores. There is often a misconception between acne sufferers that they don't need to moisturize. And the problem is that the oil levels in your skin are not a marker of the hydration or water levels in your skin. So using something like the Effaclar Duo Plus, which is non-comedogenic, again, which will not block your pores, after cleansing can be quite beneficial. The last two things that I find quite useful are salicylic acid-based toners or pads soaked in salicylic acid. So with this one, you can pop it on a cotton wool and you can put it all over the face, and the salicylic acid itself will penetrate the pore and break down oil production. This one contains pads that are soaked in salicylic acid. And this can be particularly helpful for people that have got spots, particularly on their back or their chest. So after you've had a gym workout or after you've showered or you've bathed, you can use one of these just to wipe down the chest and the back. When it comes to acne treatments, there are a lot of options available to you if the skincare is not working. Your GP or dermatologist is able to prescribe a number of prescription, tablets and creams. So you've got options such as the pill, cream treatments like Differin, which is a retinoid, and then a dermatologist would be able to give you medications such as isotretinoin, otherwise known as Roaccutane, or an off-label drug known as spironolactone. In addition to this, if your acne is fairly mild or mild to moderate, then having medical-grade facials that involve lights, laser treatments, extractions or peels can also be of benefit. Acne is something that I feel very strongly about. It's an issue that I've had with my skin since I was probably 11 years old, and I'm now verging on 40. And I think what we forget is that acne can sometimes be a chronic condition. So it can be a condition that can be controlled, but there may be no permanent cure. And that's something that's been very, very difficult for me personally to have come to terms with. I'm currently receiving treatment for my own acne. I'm 4 months into treatment with an oral medication called isotretinoin or Roaccutane, and my skin has improved drastically as a result of it. I think it's very easy to overlook the psychological effects that acne can have on an individual, and I would highly recommend anyone to not suffer in silence and seek help early. If acne is left untreated, or if you pick and play with your spots, then acne scarring can occur. And the scarring itself can be much harder to treat than the acne. About 20% of people that have acne will develop physical scarring of the skin, let alone the psychological effects that this can have. Having suffered with acne myself for a very, very long period of time, I have acne scarring. I've had this partially treated in the past with a combination of laser treatments and peels, but I still have some residual areas that are left behind where you can see indentation. I often get asked if skincare will improve acne scarring. If you have marking or staining on the skin which is flat, so red marks or brown marks as a result of your acne, skincare products such as alpha hydroxy acids can help chemically exfoliate the skin. However, if you've got true scarring where there is indentation in the skin, no amount of skincare product applied to the skin's surface is likely to make a significant difference to the scars. Thank you for watching this episode of SkinSchool. I hope my personal experience and professional advice will help anyone that's suffering with acne.